Canadians have been both saddened and angered by the number of deaths that have occurred in our nation's long-term care facility during this COVID-19 pandemic. Why is it that so many centers are understaffed? What needs to change? Today's guest joins us from Edmonton, Guy Smith, president of the Alberta Union of Provincial Employees. Guy, first of all, we want to acknowledge that the hard work and sacrifice so many healthcare workers are providing for us as they care for patients with COVID-19, of course, trying to prevent others from catching this virus as well. They're putting in a lot of hard work, right?
Oh, absolutely. We represent most of the workers in the private long-term care, and obviously at Alberta Health Services too. And I like to call them heroes. And sometimes they say to me, "Oh, Guy, we're not heroes. We're just doing our job." And quite honestly, I think they're heroes because they are on the front lines of this pandemic. They're there because they care and they're working extremely hard and obviously putting themselves at risk as well. So, in my mind, they're heroes, but they say they're just doing their job and they're doing a great job.
Yeah, I think we would all agree we need to salute them. Now, we've been hearing a lot about the problem of understaffing at our long-term care facilities, and of course, the multiple deaths occurring in elderly people in some of these centers. The province announced that they would be providing additional funding for the hiring of 1,000 additional full-time staff, and I believe that's also 1,000 students doing their practicums, and I think those
Right.
are paid practicums this time. So a
Right.
couple of questions. Have those staff already been hired?
Not as far as I know. I think the announcement was made fairly recently. What we're seeing is this government. They're making announcements, but they don't understand sometimes the complexity of actually putting those announcements into action. So as of yet, I'm not sure if those additional staff have been hired, the practicum students. But obviously, that's a welcome move. There needs to be some help on the front lines. There's absolutely no doubt about it. The staff were working short before the pandemic, and you can imagine, the workload and the intensity of that workload has increased. So more hands on deck is necessary. Absolutely.
Yeah, where do you find the 1,000 people to, come on staff right away? I guess is a good question too. Now, are these hires just temporary for the duration of the pandemic, or are they going to be kept on afterwards as well? Do you know that?
I don't know that, but it's pretty clear that we need to have more permanent staffing in long-term care, regardless. Right now, our members working across the province in long-term care mostly work two, sometimes three jobs, part-time jobs, just to make ends meet and feed their own families. So there needs to be more stability in the long-term care sector. Alberta is a mosaic or a patchwork, if you like, of various private for-profit employers, private not-for-profit employers, and some Alberta Health Services sites as well. So it's a bit of a mess out there. And if nothing else, this pandemic has really highlighted the fact that there needs to be much more coordination, stabilization across the board, because we're supporting the most vulnerable, the elderly, and honestly, they need to get the best treatment possible. And quite honestly, in some of these private long-term care centers, they're paying a lot just to be there.
Well, that's true too. Now, there's so much that goes on in these care centers. I've had my parents in long-term care, for a number of years now, and my mom has since passed on, but my dad is still there. And you see the incredibly hard work that these people put in. Now, can you explain what kind of work health care aides do specifically, and why that is actually we might say, oh, they're just healthcare aides. Oh, really? I've seen the work they do. Why is it critical
Yeah.
to the health of patients?
Well, I think anybody in a long-term care center needs to, feel cared for, supported, loved in some ways, and it's the healthcare aides look after their every need, their daily needs. Making sure that they're clean and fed, that their surroundings are clean and inviting, and also they're there as a hand to hold. They're there for someone to talk to. They're there as a consistent face and someone who is there to support to folks in long-term care. Sometimes they don't even get to see their own family, or they may not have family to see. Sometimes our members, particularly the healthcare aides, are there as part of their family, and that's a really important part. It's the physical needs, but it's also the emotional needs
Hmm.
that these healthcare aides play a major role in. But as you mentioned, they're running from resident to resident. They don't have the time that they need or want to be able to do their job effectively and properly.
Absolutely. No, they are clearly understaffed. That's quite evident if you have a parent in one of these situations there. And again, sometimes it's, you're dealing with different kinds of situations. Some people can care for themselves relatively well. Other
Yeah.
people have to, have their teeth brushed. They have to be shaved, combed,
Yep.
fingernails clipped. And there's incontinence.
Yep.
There's other issues there. You have to physically lift people sometimes. It's a lot of hard work. And
Yeah.
again, they're just running big time. So I know there definitely needs to be more people hired. Do you know any idea what the proper ratio of healthcare aides per number of patients should be? I'm not sure what the actual target is right now, and how much that needs to go increased.
Well, there are no cookie cutter approaches to this. Obviously, there's different patients and residents with different needs, and obviously, the more high acuity needs lower ratios of patients to staff. And this is one of the things that we've been calling for as a union for years: standardized ratios, staffing ratios. And rules for every employer to follow when making sure that they're hiring enough staff. There needs to be standardization and a
So,
certain.
so sorry to interrupt there, Guy. So you're
Yep.
saying that there is no standard, the government does not have a standard for that across the board?
There's no set standard. There are
Wow.
certain requirements for hours, if you like, hours of care, if you like, that each resident should be provided with by either a healthcare aide or a licensed practical nurse. And the thing is that a lot of these sites don't have enough staff to manage the number of hours of care required. So that needs to be standardized. That needs to be written into law to ensure that the companies that run long-term care centers hire enough staff to make sure that the residents get the hours of service that they need. And certainly those hours of service are less than you'd find in the public long-term care centers. And that's just because, unfortunately, these long-term care centers are run for profit a lot of times. So staffing is one of those areas where they cut back. And as I was saying, we've seen an increase in the profiteering and the privatization of long-term care, particularly over the last 10 years. It's really ballooned quite dramatically over the last 10 years. And we go in as a union and organize those workers. They see the need to be part of a union, and that's when we really see the struggles of trying to make sure that our staff, our members are protected and that they get what they need. But quite honestly, it's been a struggle, and we've had a lot of labor disputes in long-term care over the last few years because of that.
Yeah, we've seen that, and I would agree that I think there needs to be some sort of a standardized, minimum that we need to be aiming for here across the board. Now, the government has also granted a $2 per hour wage top-up here for healthcare aides during this pandemic time. So has that kicked in already as well?
Well, when the announcement was made for the $2 top up for healthcare aides, it was very unclear as to how it would be applied, which healthcare aides get it, in which facilities. And we're hearing now that it's not going to some facilities and it's going to others. We're also hearing from our members that some of the facilities it should be going to, their employers saying, well, no, you only get it if there's a COVID outbreak. Well, nobody knows what the rules are, and it's been really frustrating and confusing. But the other thing is, it shouldn't just be for healthcare aides. There's licensed practical nurses, and there's also support staff, cleaners and food service workers, maintenance workers, who are all part of that team that are supporting the vulnerable Albertans in long-term care. So it seems to have been announced without any sort of thought or analysis of how it would be applied. And that's another thing we've been pushing for, is the standardization of pay during this pandemic, at least, to make sure that there's a level playing field, because the rates of pay differ immensely amongst various long-term care centers, and so we believe it should be standardized, like they did in British Columbia. What they did is they applied the same wage rate that you'd find in the public sector to all the private long-term care centers, and it's really helped stabilize their ability to provide the services, critical services that are absolutely
Right.
necessary right now.
So they're saying that during the pandemic time in BC, they're saying, you know what, we're going to standardize this just to make sure they get the proper care in each center. So, okay, I can see that. Now,
Yes.
Now, LPNs, licensed practical nurses, can you describe the work that they provide in long-term care facilities? And is there also an understaffing issue there?
Yes, there's also an understaffing issue there because the licensed practical nurses really are the clinical experts on the floor, able to assess a patient, able to deal with their medical needs, whether they're urgent or ongoing. Obviously, the healthcare aides play a role in that, and in terms of monitoring the residents and patients they're looking for, and maybe alerting a licensed practical nurse that somebody needs immediate help, or able to provide that analysis for them. But the licensed practical nurse is the clinical expert who would provide medical services and clinical services.
Okay. Another change has been the requirement for long-term care facility workers to only work at one site. And now that's a challenge because so many are part-time, as you pointed out
Yeah.
earlier. They're working at several locations to make ends meet. So how is that turning out so far?
Well, it's really the process is still in process. It's not complete yet, even though that determination was made by the chief medical officer of health quite a while ago. There was an attempt through a ministerial order from the labor minister to put it in place with a deadline of a week ago, I think it was, to
Mm,
have it in place. There were so many problems with that they actually asked the unions to get involved to help them come up with a better plan, and that's been worked on, and a new ministerial order has been issued, but we still don't know when that is to take effect. And really, that needs to happen sooner than later. It's certainly a good move. We certainly support it. But as I was saying, when you've got workers working with two or three different employers, deciding which one to spend the pandemic time with is very challenging. And
yeah.
obviously, they're going to look at where they're going to be treated best, where the best pay and benefits are. I mean, who can blame them? They got families to feed as well. And that's one of the reasons we say you need to standardize it across the board so that workers aren't shopping around to figure out where
Hmm.
they can provide their services during this pandemic. So the new ministerial order is a lot stronger. It's a lot clearer. And that's because the unions were involved in giving some advice on how it should come about. But as of yet, it has yet to take full force
Right.
and
Yeah.
effect.
I mean, something like that. I mean, just practically thinking that through, it cannot happen just overnight. That's
Right.
a lot of sorting out. I
Yeah.
mean, where do people live, and how long does it take to get there, especially if they have to do transit in this pandemic time as well.
Right.
There's all kinds of factors involved here. But hopefully, there will be more full-time staff, and I mean, of course, there's a need for part-time as well. But in at one facility, I think that would be better basically for everybody, residents and patients and staff, right? So hopefully that continues down the line. Now, what about the new mandatory testing at long-term care facilities for all residents and staff? I mean, I guess I'm guessing that maybe should have been in place sooner. Is that what you're thinking, or?
Yeah, it should be no surprise that really the front line of the pandemic and where it's hitting the hardest is the most vulnerable and the elderly who are in these long-term care centers, and we've certainly seen that across the country and even here in Alberta. I think having that mandatory testing early on may have helped prevent some of those outbreaks of COVID in some of the long-term care centers, and certainly maybe have helped prevent some deaths. The fact that it's now mandatory for staff and residents is good, and I do believe that staff have been redeployed from Alberta Health Services, for example, to help do that. It's certainly, if you can catch it, if you can identify it before it has an effect. Obviously, prevention is much better than trying to find a cure, of which at the moment there isn't one.
Hmm. Another issue that's come up is the importance of having the proper equipment to keep our frontline workers safe. There have been complaints recently about a shipment of face masks that weren't fitting properly and apparently causing some allergic reactions, interestingly enough. Have you heard back from workers as to whether that issue has been solved yet?
Well, we're constantly monitoring the personal protective equipment that our members have access to, and how to use it properly. And that was one of the first things we did. Obviously, health and safety of workers and obviously patients and residents is the number one priority. So we were in fairly lengthy discussions with Alberta Health Services about the protocol around using proper protective equipment and when to use it. And we were told that the supply chain was healthy, that there was enough supplies to see us through this. So we were a little surprised when a new supplier provided uh, uh, masks, surgical masks, that were having a negative impact on workers. And I believe that's been addressed now. Obviously, I have staff that are supporting our members in that. I haven't heard any new problems with that.
Okay.
But when it comes to long-term care, we are hearing from staff that sometimes they don't have quick access to protective equipment. And I think that's, you have to use it prudently, right? But it has to be there when you need it. And I think there's an important balance there, responsibility on both the employer to supply the equipment and the responsibility of the worker to make their assessment of when to use it appropriately.
Okay. I'm out of time here, Guy, but I'm guessing as far as your advice to viewers, if we want to see better staffing for our parents, grandparents, we need to be in contact with our MLAs, right?
Yeah, absolutely. This issue obviously is front and center right now, is making sure Albertans are safe and healthy. But the whole issue of long-term care in Alberta will be an ongoing issue long beyond this. And I think, if nothing else, this tragic situation that we're dealing with has shone a light on something that we've been saying has been a problem for a very long time.
Hmm. Guy, thank you so much for making time for us here today.
Thank you. I really appreciate it. Take care.